What does this dress have to do with psychosis? Let's jump back to the 1850s, where we meet young chemistry student William Perkins, who in 1856 goes on to invent the first synthetic dye. This discovery was entirely accidental. He was actually trying to synthesize an anti-malarial medication known as quinine. Instead, he invents this novel dye, aniline purple. It's eventually used as a dye for a dress worn by Queen Victoria, after which the color really takes off in popularity. Perkins was able to see a commercial application for his dye, and his discovery heralds a new era for synthetic dye in textile industries, but also that of organic chemistry. Synthetic dyes actually paved the way for synthetic drugs, medications, and this is true of the first antipsychotic medication. About 20 or so years after Perkins' discovery, of German chemist Heinrich Caro discovers another aniline-based dye, methylene blue, which is still incredibly useful in science and medicine, especially for things like staining. See this picture? That's methylene blue at work. Methylene blue was also used by German scientist Paul Ehrlich, who's of Salvarsan fame. He realized that methylene blue had potential as an anti-malarial medication. It all ties back to malaria. Methylene blue is a phenothiazine compound. And what else is a phenothiazine compound? The first antipsychotic. In the 1940s, scientists are trying to develop new antihistamines after the success of a popular drug that you might know the name of, Benadryl. Doctors, scientists believed that antihistamines could be helpful in solving the issue of surgical shock, where a patient's blood pressure, heart rate would suddenly drop, tank, during surgery in response to anesthesia. Also, having to go through surgery was a major stressor. Patients were really anxious before it, so was there a medication that could reduce the risk of shock and also reduce patient anxiety? French scientist Paul Charpentier and his team came up with an antihistamine that was a methylene blue derivative part of this important phenothiazine group. It was called promethazine. French surgeon Henri Laborie got his hands on promethazine and wondered if it could help with the surgical shock anxiety problem. He found that it helped with sedation, it reduced the amount of anesthesia necessary, and it reduced anxiety. He reaches back out to Charpentier and wonders whether there are any other similar antihistamines. What were Charpentier and his team able to synthesize? Chlorpromazine. Chlorpromazine also had these anti-anxiety sedating effects. Many psychiatrists working in Paris started to test chlorpromazine on their patients, and they found it really useful in managing psychosis, mania, helping with sleep. By the mid-1950s, chlorpromazine is on the market. In France, it's marketed as largactil, meaning large activity. In the United States, it's marketed as thorazine for the treatment of various psychiatric conditions like schizophrenia. Some people have described the discovery of chlorpromazine as a matter of luck and serendipity, and sure, there was a lot of that involved. It took decades, centuries of hard work, deliberate decision-making, and it does still kind of tie back to a purple dress.